Hello, I am Dr. Dhruv Zutshi. I am a senior consultant neurologist. Today I'll be talking in brief about headaches and migraines. Is headache and migraine the same thing, or are they slightly different in nature? If we look at it, headache remains one of the most common neurological problems in the world. In the US, they say that nearly 1/3 of the population at some point of the year is suffering from a headache, or most commonly migraine. So what is migraine? Migraine is the most common of headache that one can encounter in their lifetime. Now migraine can be episodic, that is one-off, or can be a chronic migraine. The importance of understanding this is because you will decide which patient to treat on a regular basis or which patient should just be given a pain medicine which they can take whenever they have the pain. So what happens in a migraine? These are long duration headaches. By long duration means at least running for 3 to 4 hours and longer. Then the headaches, generally believe that migraines are hemicranial headaches. Yes, they are commonly hemicranial headaches. However, migraine can start from any part of the head and become a holocranial, means involve the whole head. Quite commonly patients experiencing some throbbing or bursting sensations in the head. However, it may not be true for all patients. Some patients may experience just pain, some may experience heaviness, some may experience abnormal sensations of the head. These headaches are quite disabling in nature, that is, the person has to stop their work and go and take some rest, and it is only after a few hours that they are able to resume their work. Hence, migraine remains one of the biggest cause of people taking leaves from work, and hence it has a lot of economic importance, if not any way of disabling the person. Migraineurs, when they are experiencing a severe attack, quite often complain of extreme sensitivity to light and sound. They just feel like I should go and lie in bed, put off the light, don't talk to me. They become very irritable. Then they also experience a lot of nausea and vomiting. Some migraineurs experience something called as a sleep benefit, that is, they feel better after they slept. Now, what triggers a migraine? Like common triggers are sense of smell. These patients have a heightened sense of smell. So a lot of times these patients say that perfume लगाते ही सर में दर्द start हो जाता है. Or if somebody else is also put on a perfume or some another smell, or even a naphthalene ball put in the room or in their suitcases can trigger a severe headache. Then they notice something with diet, like quite often caffeinated drinks can trigger a severe headache. Going out in the sun can trigger headache. Hot weather triggers a lot of headache. So these patients generally do better in the colder months. What other things are common in migraine? Yes, it is more frequently experienced by females because it has the estrogen dominance. And during their periods, a lot of females start experiencing severe headaches. Now, these are just menstruation-related migraine-like headaches. However, quite often they are unable to understand and they keep tolerating the headache for years, believing that it's just a menstrual-related problem. It's actually a migraine getting triggered by that change in hormone in the body. Migraines, a lot of people, there is a belief that migraines have no treatment, which is not true. Patients who are experiencing 4 or more headaches in the month are generally given a set of medicines which they have to take continuously, like a course. And when they take it for a while, generally 2 to 3 months later, their headaches become very, very less. That is when you can tell the patient that they can use any painkiller which they are comfortable with when they are having a headache, else they can be off the medicine. So the purpose of treating the migraine becomes from a patient who is experiencing very frequent headaches to one who is now experiencing very few headaches. So that is how migraine is. Yes, there may be a tendency for the headache to come back somewhere down the line. We can't predict all those things. However, patients who respond well to treatment require very short courses and quite often do very well on treatment. Thank you.